Hello, Dr. Grunfeld. Greetings to Israel. Thank you for answering. As we could hear this year at Konoplje Symposium, you have plenty of experiences, clinical and observational, how to treat patients with cannabis. So we are very lucky to have you in the coming October at the Demystifying Cannabis seminar. So, of course, we would like to hear something about your current work.
I am actually in a state of transition now. After very many years of working in the clinic, I am actually moving out and going to be working more with research in the industry. So I am exactly at a turning point in my personal career. I guess what is relevant as far as the symposium is concerned is that I have been working until now for over 10 years actually using cannabis specifically as one of the means, one of the treatments, mostly in taking care of patients with cancer and also with other neurological and other indications for use of cannabis. So over the years I have had a relatively unique position because I could issue permits on my own and I could had some degree of control over how much cannabis the patients are receiving and to an extent what kinds of cannabis they were using. Until now, and I think around the world, basically it is very difficult to have optimal control over a regular cannabis-based treatment of various symptoms or disorders. Generally speaking, there is room for several approaches to the use of cannabis, okay? And I think that they are complementary. No one approach provides the ideal answer for everybody. Some people need simply more access to cannabis on a more non-pharmaceutical level. And people are using cannabis nowadays and managing problems, including health-related problems, with cannabis just like that. So they don't need any special medicine or protocol or recommendation from a doctor. They get along and they make use of it for themselves, so they can sleep at night, so they don't suffer that much pain, so that they are more relaxed, they can deal with their stress. All kinds of people have different personalities and different situations in life, and the cannabis helps them. The question is where the idea of medicine and medicalization comes in. And it is a problem, okay? On the one hand, there are all kinds of interests, vested interests of companies, of institutions, of all kinds of official bodies and organizations, which all have an agenda. Now, behind all of that, from my experience too, I know that there are people who have medical needs which are unanswered. And we, as representatives of the medical institution, people who are trying to provide medical service to people who need it, are obliged to find ways to exploit all the benefits that we can find in the cannabis and in all kinds of cannabis-derived preparations. Now, this is a different aspect. So one is very formal, and it goes more and more and more in the direction of pharmaceutical industry, really, with a specific protocol, with specific components. It has to be rigorous. You have to know what you are giving. You have to know that every time you give it, you know what you are giving. You can control. The patient has control over what he is getting. And on the other hand, you have the informal aspect, which is also important. It provides a relatively good solution for a very large expanse of the population. I think it is important to point out that there are clear observations which are undeniable that cannabis can help many people of many ages with various significant medical conditions. And that is something that cannot be denied, even if there is not a lot of literature to back that up.
What will you be talking about at the seminar?
Yeah, well, in the seminar, generally what I will try to do is to present, once again, what the current approaches to medical use of cannabis are in the world, where things stand in the eyes of the formal institutions. I'll relate to the position of the World Health Organization, of the United Nations institutions which are relevant to that question. And I will try then to give it some perspective with illustrations from my personal experience. And I think I will also try to point out, from my personal perspective, the trends that we are observing nowadays, where things are heading with regard to the medical use of cannabis.
Great. And whom would you like to invite to the seminar? Do you see any opportunity at such events?
It's a big question. There are a lot of people, of course, on the one hand, there are people who are influential, and you want people who have influence, who can have an impact on the acceptance of cannabis, to be in such a seminar so that they can move on and provide support. On the other hand, you would like to see people who are using it as clinicians, and on the third hand, people who are unacquainted, unfamiliar with the cannabis, and are concerned about its being tagged as a drug, as something that is not good, with all kinds of negative connotations. And it is important for them to hear that cannabis is, the medical use of cannabis is a serious subject. It is not a joke. And that if they refuse to hear about it, then maybe if they are in a situation where they could benefit from it, they are really giving up on something that could make their lives better and the lives of the people around them. We need people who can influence the acceptance of cannabis, both from the media, from the politics, from medical institutions, from insurance companies, God knows. All these people, once they understand, they have a better grasp of what it is about, can contribute. And on the other hand, the people who are using it, the doctors, the nurses, the social workers, who are also accompanying the people who actually need the cannabis to help treating their medical problems.
Mm-hmm. So it's a great chance to inquire and to learn at this event for everyone. Thank you so much for this conversation, and see you then in October, and looking forward to.
Okay, great talking to you.